Well, the first thing when you hear MSA as a diagnosis is you don't know what MSA is. And then you immediately get into, well, how quick, how fast, is it weeks or months or years? And the answer is you don't know.
The patients who are unfortunate to have multiple system atrophy have multiple systems involved, so you can't define it as one particular part of the brain, but rather multiple areas affected simultaneously. The characteristic features are patients who have a problem with movement, whether it's ataxia or trouble with balance like Parkinson's disease, along with difficulties with the automatic functions of the body, blood pressure, bladder, bowel, sweating, those kinds of things. And then the very important but sometimes overlooked problems with depression and loss of autonomy and isolation that can go along with a disease like this. And then, the burden on the caregiver in trying to help the patient manage with those things and taking an emotional strain on themselves. Our goal has been not only to provide the standard care to patients with MSA to put them on the right medicines to help treat their symptoms, but also to keep in mind the other aspects of their quality of life. A lot of patients don't have good support systems, we're living alone, don't have family who can spend the time to take care of them. Typically they lose mobility very quickly and end up in nursing homes, and their life expectancy is rather short. The main thing people can do is educate themselves and then educate others. So I think a lot of these neurodegenerative diseases, patients become isolated, the family doesn't go out, and their friends and family just don't see them anymore. They say, what happened to our friend? They're just sort of gone. Patients and their families and their friends should say, this is what's going on, this is a terrible disease, and there's a lot of people working on trying to make the situation better.